Hello, Professor and my classmates. This is Kaur. I'm from Bakersfield, California. Currently, I'm enrolled in FNP 597, and currently, I'm doing my rotation with Dr. William Bishai. He's located at 3900 Sandima Street, Bakersfield, California. And today, I'm going to present a women health case, which is very meaningful and memorable to me, as I have encountered this patient independently, and this patient was very cooperative and very polite, and she was like very much engaged in this case, and she was having so many questions regarding her problem. So that's why this is very memorable and very interesting for me, as well as challenging, as I was like doing by myself. For this case, my client's initial is KK. She's 26-year-old, African American female. Date of birth is 12 June 1997, and she was having current family. Marital status single. She came to the clinic by herself. She appears to be a reliable historian. If I'll talk about the subjective, the chief complaints: for the past 4 days, I have had an abnormal discharge. During a urination, I experience burning sensation as well. For HPI, KK is 26-year-old African female who presents to the clinic with the complaints of burning sensation during urination and abnormal vaginal discharge. She states that her urination become more frequent for the past 4 days, and which is accompanied by the lower abdominal pain, especially in the morning. KK describes that her discharge is very yellowish and smelly in the morning, and after that, like after urination, she's feeling itchiness, and she's feeling itchiness in her private part, which is like giving her very discomfort. She reports that she never had a similar symptoms before, and she also reports that she recently have unprotected sex with her new boyfriend, that they have been together from last 3 months, and she has not used any medications to relieve the symptoms, and she does not know what are the aggravating or relieving factors. And she reports that she is not in any distress, or her appetite and sleep does not get any changes. For the past medical history, she has a like problem list. She was having chicken pox at the age of 6, asthma since the age of 13. She does not have any kind of preventive vaccinations and surgeries. She has a tonsillectomy at the age of 2, and hospitalization, she does not reported any hospitalizations. LMP 2 weeks ago. Pregnancy, none. For allergies, she does not report any kind of food or seasonal allergies. But she reported like she's allergic to cat fur. Medications, she is using Foralin 200 micrograms inhaler, 2 puffs BID for her asthma. Family history: her mother is alive, she's 57, with no health issues. Father is alive, also 62, with no health issues. Younger brother, he is 18, and maternal grandmother, age 83, with a history of asthma. Maternal grandfather died at the age of 84 with type 2 diabetes and post-cholecystectomy syndrome. The rest of the siblings and other members of the extended family have no health issues. Social history: KK is the third born in a family of 5 and lives with her boyfriend in a nearby town. She has no children and never have been pregnant. She is currently not working but undertaking her postgraduate business course. She moved into her boyfriend's house a month ago, but they have been dating for 3 months. KK lives in a safe neighborhood and always wears a seatbelt while driving. Sexual history and contraception protection: IUD, birth control, sexually active with one partner and engages in unprotected sex. Chemical history: she is denies using any kind of tobacco, alcohol, or drinking, but she is drinking occasionally on the weekends. She occasionally use marijuana with her boyfriend as well. Others: KK engages in regular exercises and eats homemade food. ROS constitutional: patient reports fever but denies recent weight changes or any appetite changes. Eyes: she reports eye redness and pain but denies dryness or discharge. Ears: for ENT, she denies any hearing loss or any nose problems. She denies any dysphagia, denies any voice hoarseness, cardiovascular. She denies chest pain or palpitations, pulmonary. She denies a history of wheezing, dyspnea, or coughing. GI, she reports lower abdominal pain but denies loss of appetite, nausea, diarrhea, and vomiting. Genitourinary, she reports increased urine frequency, urgency, and burning sensation during urination. However, she denies a change in the color of the urine. She reports a yellowish, smelly discharge that is heavy in the morning. She denies a history of pregnancy but reports being sexually active and engaging in unprotected sex. With her partner, she has used IUD contraception for the past 2 years. She reported a normal pap smear a year ago but has never done a mammogram test. Menarche at 15, and she also reports normal menses but denies any dysmenorrhea and any heavy menses. Musculoskeletal, she denies any back pain or joint swelling. Integumentary in breast, denies any breast changes, any lumps or bumps. Neurological, denies any dizziness, transient paralysis, paresthesia, or syncope. Psychiatric, she denies any suicidal ideations. Endocrine, she denies a history of blood transfusion or any heat or cold intolerance, night sweats, increased thirst, or swollen glands. The vital signs are within normal range. She has pain 4 out of 10, height 5 feet 7 inches, weight 149 pounds, and her BMI is 25.4. If I'll talk about the labs and radiology, urine analysis was positive for chlamydia. CBC shows elevated WBCs indicated an infection. She has that get done in the urgent care, so she was bring this report to the clinic. Physical exam, general appearance, KK appears well groomed, well nourished, and her stated age, skin moist, warm, intact. HEENT, head is normocephalic, no problems, eyes perla and intact, EOMS but red conjunctiva, ears bilateral, TMS and patent canals, nose pink mucosa with no septal deviation. Neck, no thyromegaly, no cervical lymphadenopathy, throat, no problems with the pharynx and with no exudate, cardiovascular S1, S2, noted with no murmurs, normally capillary refill with pulses, 3 plus regular heart rate and rhythm, respiratory symmetric chest, no wheezes or crackles noted, gastrointestinal non-tender abdomen with bowel sounds present in 4 quadrants, no organomegaly, breast, no masses or discharge, genitourinary, no external genitalia or vulvar lesions, no CVA tenderness. Vaginal examination reveals a reddened and moist mucosa with some yellowish discharge. Tenderness in the lower pelvic region was noted on bimanual examination. Musculoskeletal, full range of motion in all extremities. A muscle power 5 out of 5. Neurological, she is aware about the surroundings and for no forgetfulness noted. Psychiatric, alert oriented, time 4. Lymphatics, no enlarged lymph nodes noted. For assessment, my differentials would be chlamydia infection unspecified. The rationale behind is that it is likely diagnosis in this case supported by the urine test positive for chlamydia infection, and CBC is also elevated, showing elevated WBCs and indicate a sign of infection. Chlamydia is a common STD which affects mostly young women and associated with the painful urination, vaginal discharge, lower pelvic pain, and conjunctivitis is also present. Chlamydia is mostly spread through vaginal, anal, or oral sex from one infected person to another, which might explain the case of KK who has a new sex partner and engages in unprotected sex. My second differential would be vulvovaginal candidiasis. The rationale is it is probable diagnosis in this case supported by the presence of vaginal discharge, increased urine frequency, burning sensation, itchiness after urination. So the vulvovaginal candidiasis is a yeast infection associated with itching and irritation in the vagina and vulva and a burning sensation while urinating. However, a possible diagnosis of vulvovaginal candidiasis is ruled out by the diagnosis and scanty vaginal discharge, unlike clumpy, white, and decent discharge common with vulvovaginal fungal infections. Next is UTI, site not specified. Rational, it is another possible diagnosis in the case of KK supported presence of vaginal discharge, increased frequency and urgency of urination, and itchiness after urination. UTI affects the upper urinary tract, including the kidneys, ureter, and pelvis, and the post implicated microorganisms are fungi and bacteria like Pseudomonas. However, a possible diagnosis of UTI is ruled out by the absence of severe and frequent chills, fever, and groin or flank pain. My diagnosis would be chlamydia infection, and my plan for this patient is to get some diagnosis test, additional testing using a cervix, vaginal, anal, or throat swab to confirm the presence of chlamydia trachomatis. Treatment would be a doxycycline 100 milligrams of BID for 1 week and azithromycin 1 gram, then 500 milligrams OD for 2 days for chlamydia. Health education is given to the patient, educated the patient to abstain from the sexual activity until the infection get cleared, and she will finish the antibiotics. Education is given. Educate about informing sexual partner to seek the treatment as well. Educate to use safety while intercourse to prevent sexually transmitted infections. Education provided about the importance of the follow-up treatments. Follow-up 3 months after treatment of an initial infection for retesting whether she has been cleared from this diagnosis or no or not. Hello, if I'll talk about the holistic approach and caring science, I have used a shared decision-making choice to discuss treatment options, risk, and benefits in culturally sensitive manner that can also respect the patient's beliefs and values, which can improve the patient satisfaction and outcomes. Secondly, from Jean Watson's caring theory, I have used to develop and maintaining the trust with the patient, because trust is an essential factor in the patient-provider relationship to achieve better outcomes by involving the patient and family in decision-making, autonomy, and following through the commitments. In the last part, by incorporating all the by including the holistic care, which including physical, emotional, social, and spiritual needs, can lead to improve outcomes and a better overall quality of life. Hope you guys enjoy my video. Thank you so much.